Navigating ADHD testing. Do you have difficulty maintaining attention at work, in school, or at home? Do you experience hyperactivity that leaves you feeling overwhelmed or anxious? Are disorganization or impulsiveness getting in the way of your responsibilities or relationships? Over 360 million adults worldwide experienced symptoms of attention deficit hyperactivity disorder in 2020, and those symptoms can impact many aspects of life. Oftentimes, an ADHD test or assessment may be the first step toward diagnosing ADHD in adults and receiving effective treatment. Hi, I'm Melissa Hummelt, a licensed professional clinical counselor with BetterHelp. For many, receiving an ADHD diagnosis may feel relieving, as it can validate any struggles you've experienced throughout your life and help you find effective treatment. If you're looking for answers on whether you're experiencing ADHD, you're not alone. In this video, we'll discuss what an ADHD assessment looks like, along with when and how to get tested, plus potential ways to manage symptoms. But first, let's talk a little more about what ADHD is, its symptoms, and what might cause it. What is ADHD? Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder that can cause significant impairment to an individual's mental health, physical well-being, and ability to function. While symptoms may begin in childhood, many cases of ADHD persist into adulthood, and not all children get diagnosed early. Often, adults and children diagnosed with ADHD have trouble paying attention, organizing their time and space, controlling their emotions, and finishing projects they've started. Individuals with ADHD may feel restless, have difficulty unwinding, and experiencing hyperactivity. Although many people experiencing ADHD might have difficulty concentrating on certain projects, they can exhibit a strong, sustained focus when they're engaging in an activity that interests them. For example, they may abandon a school-related task to hyper-focus on stimulating activities such as video games or other activities they feel passionate about. Symptoms of ADHD may also fluctuate throughout the day, depending on demands and stimulation from a person's environment or relationships. ADHD is thought to be partially caused by low levels of dopamine and norepinephrine in critical areas of the brain responsible for controlling behavior and attention. Family history can also play a part in ADHD, as according to research, receiving an ADHD diagnosis is 74% hereditary. That means individuals with family members who live with ADHD are at an increased risk of developing ADHD themselves. However, many people may not receive a diagnosis until they're teens or adults due to stigma or misunderstandings about how ADHD functions. When should I get tested for ADHD? Struggling with focus, making small mistakes, or acting on impulse can feel overwhelming at times, and undiagnosed ADHD symptoms can interfere with your ability to keep a job, make and manage interpersonal relationships, spend money wisely, and take care of your physical health, among other activities. Being diagnosed with ADHD may help you understand which support tools will be useful in your life, and it may help you find effective treatment and recommendations for support groups, services, benefits, and controlled trials. If you're unsure whether you should get an ADHD assessment, ask yourself about your symptoms. How are they impacting your life and mental health? Are they impairing your ability to function? If you feel that you have a handle on your disorganization, distractibility, or impulsiveness, and don't think you would benefit from a formal ADHD diagnosis or treatment, you may not need to meet with a provider. However, if you feel that your ADHD symptoms are getting in the way of your ability to be successful and causing significant stress, a professional ADHD screening may open more doors for treatment and management. Many research-backed treatments can minimize the impact of ADHD on your life. You may be able to receive accommodations at work or in school, such as quiet testing environments or assistive technology. You might also feel relief by putting a name to what you've been experiencing. How is ADHD diagnosed? To receive a proper diagnosis of ADHD, you typically must consult with a licensed mental health professional who can provide a comprehensive ADHD evaluation. The healthcare professional will likely administer ADHD screenings, a physical exam, and other assessments to ensure there isn't a medical condition or another mental health condition causing the symptoms. The effects of certain health concerns, such as a physical health condition that causes hearing impairment, can mimic ADHD symptoms. Additionally, common symptoms of depression and anxiety can resemble ADHD symptoms. Once your provider has ruled out a physical health condition, they may then compare your symptoms with the diagnostic criteria for ADHD. For healthcare providers to diagnose ADHD in adults, there typically must be at least 5 symptoms present of the 9 symptoms outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. How do I get tested for ADHD? If you found that ADHD symptoms are interfering with your life in one or more areas, you might consider seeking an ADHD diagnosis. Maybe you've tried several techniques for time management, getting organized, impulsive behaviors, or other areas without much success. In these cases, getting an ADHD diagnosis could be beneficial. If you prefer, you can take an ADHD assessment online as a first step. An online assessment does not substitute for a doctor's diagnosis or professional services. However, it may help you push you toward a formal ADHD diagnosis if you're unsure. It could also help you cope with your feelings and validate your experiences. There are several online ADHD tests available, including the Adult ADHD Test from the Attention Deficit Disorder Association, or the ADHD Test and Assessment Diagnosis Criteria from the CDC. You can find those links in the description. Those who perform formal assessments to diagnose ADHD may be psychiatrists, neuropsychologists, psychologists, or another type of medical professional. In some cases, a family doctor or primary care physician may be able to provide a diagnosis as well. Other places you may be able to find an ADHD assessment include an ADHD hyperactivity or neurodivergence clinic, with an ADHD neuropsychologist, with a psychiatrist who specializes in ADHD, with your therapist through your school or university or through a vocational program. How is ADHD treated in adults? If you receive an ADHD diagnosis, a comprehensive treatment plan can help with the practical, emotional, and cognitive challenges ADHD symptoms often present. The most effective treatment known for ADHD often includes a combination of stimulant medication, cognitive behavioral therapy, and diet and exercise adjustments. Your doctor may also give you specific recommendations to help you manage your ADHD. If you're interested in internet-based therapy, platforms like BetterHelp can connect you with a licensed, experienced therapist to help you effectively manage ADHD symptoms. What strategies have you used to manage ADHD symptoms? And do you think a diagnosis could help you receive the tools you need to manage them more effectively? For more information on how providers might arrive at a diagnosis, check out our video on 3 things everyone should know about the DSM-5. And if you found this video helpful, give it a thumbs up, subscribe, and turn on notifications for more information and tips on managing ADHD. ADHD can impact many aspects of your personal life, career, and relationships. Being evaluated for ADHD can be a proactive way to help receive treatment and live a happier, healthier life. Watching this video may have been the first step, so thanks for joining us today. Until next time, take care and remember to subscribe for more mental health insights and strategies to improve your well-being.